Good morning. So in reflecting about this topic about data sharing, I had to think back over my own career as an epidemiologist, and I realized there are only 2 times when my data have been requested. And they've been very interesting, and I thought I'd share them very briefly. The first was at the very beginning of my career, an outbreak that I investigated that involved pesticide-contaminated watermelons. And a few years after that outbreak, the company that manufactured the pesticide requested to see all the original outbreak reports that the state health department, I was working for the state of California at the time, had taken, which contained the names, addresses, phone numbers of the people who were calling their state health department or their local health departments to report illnesses. And we had analyzed those illness reports and, done written papers about it and so forth. And our attorneys said that they couldn't protect those data. And so I remember spending a weekend going through piles and piles of the thousands of these case reports, literally, and blacking out, redacting all the personal identifying information, the names, addresses, and phone numbers. By the way, without specific advice from counsel, so the lawyers in here can comment on that I could do that or should do that. I just did it because I thought it was the right thing to do. The second happened fairly recently, a cross-sectional study that I was involved with where we looked at exposure levels of certain environmental contaminants in newborns vis-a-vis birth outcomes and other changes. And a person at another university who's doing a systematic review of that contaminant and birth outcomes requested the data set to analyze the data. And we had a policy, our research group, that we needed a proposal that had an analytic plan and described who would be doing the analyses. And that researcher said, oh, that's an interesting idea. I'll do an analytic plan. So she didn't have one, I guess. And she sent it to me, and when we looked at it, there was such a simple idea. She just wanted a different statistic, a slightly different statistic than the one we had published in order to do the systematic review. We realized rather than go through the effort of creating an entire data set for her, a data dictionary, explain the variables to her and all of that, it was just easier to compute those statistics for her and provide them to her. So, my experience has not been that this has been a particularly difficult issue, but certainly one, in the first case, that can be quite contentious when it's occurring in the context of litigation. So in welcoming you here, and that includes those of you who are on the internet as well, I'd like to remind you that this is, as a roundtable, this is a mechanism for parties interested in environmental health to meet and discuss sensitive and difficult environmental health issues of mutual interest in a neutral setting. And that the purpose of this meeting is to foster dialogue, but not to provide recommendations. This is not a consensus-making workshop, and in fact that by design, the Workshop Planning Committee has attempted to include various perspectives that will really help to shed light on this issue and foster what we hope will be a deep and very interesting discussion. So I'm leading off with a little bit of the context that we'll hear a lot more about, I'm sure, from the attorneys, that the fact that in 1998 that there was actually a law enacted called the Shelby Amendment, making a requirement that federally funded research data is made available to the public under FOIA, and that this had been enacted in response to concerns about a desire to reanalyze 2 studies, the Harvard 6-City study and the American Cancer Society study, that were looking at particulate matter health risks. And that Congress then further acted in 2001 with the Information Quality Act, which subsequently resulted in regulations, really guidelines, not regulations, by the Office of Management and Budget, that since that time has affected how the agencies respond to requests for data, but also for what are called information corrections, not just supplying data, but correcting information that is promulgated. So a couple of years ago, a couple of us looked at the experience at the Environmental Protection Agency under the IQA and found that according to EPA's webpage, At that time, over 10 years, there were 79 requests that had been filed. And these are letters that are written to the EPA. And of these, only 2 actually asked for raw data. So the request for raw data was not a common request. And the first case was a case that involved a perchlorate study. The requester was an industry consortium called the Perchlorate Study Group. And EPA actually had data from a contractor that it was able to make available after receiving this request, and it allowed them to examine the original brain images, which they wanted to look at from the animals, I hasten to say, that were studied in this study, as well as the original contractor's reports that actually contain data tables. And so the second request, a little more interesting, especially for many of us who are involved in epidemiology, but also in the conduct of systematic review. In 2008, another industry group called the Association of Battery Manufacturers asked for raw data from a study of lead toxicity that was actually itself a systematic review. Bruce Lanphier, who we did try to invite to be here and was not able to come, had solicited from colleagues all over the world raw data from studies that they had carried out of lead toxicity on IQ of children, and then he used those data to do a systematic review that EPA to some extent did support. EPA provided Dr. Lanphier with some of the funding for this systematic review. And EPA then used the result of this review for developing a lead and air standard called a NAC, which is not important what that means for this meeting. But so, and I spoke with Bruce about this at the time we did our review. He felt, because he had signed data transfer agreements with these investigators, promising that he would not release these data to other people. And I think understandably, you transfer material, you transfer data to another investigator, you often have these data transfer agreements. So he felt that those agreements precluded him from sharing those data with anyone else. However, EPA ruled that the data needed to be made available pursuant to Shelby because of the fact that some federal funding had been made available for doing this systematic review. And there were some other wrinkles to this, such as the fact that the battery manufacturers were suing EPA about the NACs, and EPA didn't want to act until the lawsuit was settled, and But at the end of the day, EPA prevailed upon Cincinnati Children's Medical Center, and Bruce's hard drive was taken and provided to EPA. Now we're at a time where there's actually a new request for EPA to release raw data from the Harvard 6 Cities and the American Cancer Society studies. Most recently, earlier this month, Senator Vitter, and I just have a quote from him, as the input and output files are fundamental to conducting reanalysis, repeatedly requested that EPA obtain all the data files, determine which data files pose a threat to privacy, immediately release all data files that do not pose a threat to privacy, and investigate measures to remove all personal health information from the files. And so, this is clearly, again, coming up. I think we're going to hear a lot more about this situation. But also, last month in February, an actual statute was introduced in the House of Representatives to prohibit, it says, these are the exact words, the purpose, to prohibit the EPA from proposing, finalizing, or disseminating regulations or assessments, not just regulations, based upon science that is not transparent or reproducible. And specifically what this does is it says that the data have to be specifically identified and publicly available in a manner that is sufficient for independent analysis and substantial reproduction of research results, and that a covered action does not just mean a regulation, but it's also a risk, exposure, or hazard assessment criteria, document, standard, limitation, etc. Almost anything that the agency does. There are other details in this proposal that are interesting, but I'm not going to go through in detail. So I just have a minute left, but I did want to make sure that in our discussion today, if we're going to have this conversation, that we're clear about the language that we use. And one thing that I've noted in this is that some of the words that we use in science get tossed around a lot, have not sometimes been used consistently. So I'm going to go through this. Peer review is when you actually evaluate the scientific work. Others in the same field do an evaluation. A reanalysis is when you conduct a further analysis of data or again analyze data. Replication, though, means that you actually repeat a scientific experiment or a trial to obtain a consistent result. And then finally, when you reproduce, you're producing something that is very similar to that research, but it's in a different medium or context. A systematic review is a summary of the clinical literature. There are various methods that people can use, including they can quantitatively pool the data or do a meta-analysis, which is a way of combining data from many different studies using a statistical process. So how can we use shared data? For peer review, certainly, although we usually don't look at people's data sets when we do a peer review. We don't usually look at the raw data, but we could do that. Certainly for reanalysis. Certainly for reanalysis. And often for systematic review, as in the example of my own experience where you needed to reanalyze the data in order to conduct the systematic review, but not for replication or reproducing, which requires that you go to a different population or do the lab experiment over again, or even do the research in a completely different way. So we have many issues for discussion. The current legal and executive branch framework for data sharing, which we're moving to next, the benefits of data sharing, some of the challenges that are associated with data sharing, and then we'll as Frank said, close with some possible ways forward. I look forward very much to today's presentations and discussions, and I hope that we're able to shed light on this very important issue. Thank you.